Good afternoon, everyone. Thank you all for joining us. We will just give everyone another moment to be able to join the panel discussion today, and then we'll get started. All right. Good afternoon, everyone. Thank you all for joining us today for the Outpatient Services Hiring Event panel discussion. My name is Sky Kellogg, and I will be your host for today's event. Advent Health, as you may know, spans across 9 states with over 50 hospitals, home health, and hospice agencies, and 60 urgent care facilities. So our hope today is that you will be inspired to join the Advent Health family after learning more about us and attending our upcoming hiring event. Today, we will dive deeper into 3 unique service lines that fall into our outpatient services group. We have the opportunity to hear from leaders within Advent Health Sports Med and Rehab, imaging, and our medical group specialty care. So without further delay, let us meet our distinguished panelists. If you could, please share your title, role, and how long you have been with Advent Health. And we will start with Keisha.
Thank you, Sky. Hello, everyone. I'm so excited to be here with you today. My name is Keisha Moore. I am the Senior Manager of Clinical Education and Training for Advent Health Medical Group's Central Florida Division. I've been a nurse for over 20 years, and I've been with the medical group for the last 7 years, in this position for 3. So I hope you gain lots of valuable insights from this virtual event today that'll help you help motivate you to join our team. Thanks, Sky.
Yeah, thank you for being here today, Keisha. And Andrea.
Thank you, Sky. Good afternoon, everyone. My name is Andrea. I am the Director of Operations for Imaging in Central Florida Division, one of our leaders, specifically over the outpatient imaging centers that we have here, ambulatory. And I have been with the company for almost 7 years, started frontline staff and grown through leadership as well. Used all of our benefits, tuition reimbursement, go back to school. So it's been a great journey with Advent Health. And I'm happy to be here.
Thank you so much. And Jill.
Good afternoon, everybody. Echoing our team members' excitement here on joining you guys today, but I am one of the directors for Sports Med and Rehab. I'm actually celebrating my 15th year with Advent Health this year, and happy to say I've been within the same department the entire 15 years, which is exciting. I actually have oversight of clinic operations for 11 clinics in our Flagler, Lake, and Volusia counties, as well as leading our talent acquisition initiatives over our entire department. So excited to be with you guys today.
Thank you so much for being here, Jill. And thank you again for your time and being able to impact our participants today. So for our participants, your mics have been placed on mute. However, we encourage you to use the chat function to engage and share your comments and questions in that chat. Towards the conclusion of our panel discussion, we will dedicate time for our panelists to address your questions live. And again, we value your participation and for joining us today, and we look forward to having a very interactive session. So with that, let us go ahead and get started. So to begin, could you please just give a brief overview of your respective area within outpatient services, giving our listeners today an idea of the types of patients that you're working with and how it differs from our hospital facilities. So I will start with you, Jill, with our sports med and rehab.
Absolutely. So our area is focused on outpatient rehab services across 7 counties. So I mentioned the 3 that I have oversight of in what we call the East Florida Division, but we also include Orange, Osceola, Seminole, and Polk counties. We offer physical and occupational therapy and speech language pathology, in addition to other services, over 40 locations, which is exciting. We have there's obviously multiple settings within for the therapy world. So home health, inpatient, acute. And so we're solely outpatient, but we get the opportunity to collaborate with our peers in inpatient and acute as well. And so we also care for patients of all ages, and our clinicians are actually subspecialty focused in orthopedics, vestibular, neuro, pediatrics, pelvic health, and oncology lymphedema.
Thank you so much, Jill, for that overview. I appreciate it. And we will move to Advent Health Imaging.
Thank you, Sky. So with Advent Health Imaging Centers, we have 13 locations currently. We have been growing quite a bit, ranging anywhere from Osceola, Seminole, as well as Volusia County, Port Orange, all the way to Celebration. Um, we have quite a bit of modalities that we run. So ultrasound, mammography, CT, MRI, X-ray, DEXA, including procedures and some new ones that we are trialing out as well. So of course, US guided biopsies, one of our newer tests is CT colonography that we have been pioneering, CT heart scores, and quite a bit more. So it's been a great journey and we look forward to keep growing as well.
Thank you so much. And finally, Keisha.
Yes, so thank you. Advent Health, the medical group, is made up of an array of specialties that provide this ongoing care for our patients' specific needs. Some of our specialties include women's health, cardiology, orthopedics, urology, diabetes and endo, and we can't forget our pediatric specialties. We manage our patients' care at their level to promote more of a whole person type care. So we care about their mind, their body, and their spirit. I can't tell you the differences between the medical group and the hospital environment is that unlike the hospital that's comprised of primarily RNs, the medical group has a workforce that's made up of RNs, LPNs, and medical assistants that work hand in hand for our patients. In addition, the hospital environment seeks more to stabilize an acute patient condition. The medical group, on the other hand, will either identify an acute patient condition and then send them to the emergency room or get them admitted. And then once they're discharged, we also manage their care to get them back to their baseline or even better. And lastly, our schedules do differ from the inpatient side. Many of our practices are open during business hours as opposed to requiring staffing around the clock, which is definitely a plus.
Thank you so much, Keisha. And again, just to mention, outside of our sportsmen and rehab imaging and our Advent Health Medical Group specialty care, this event that we are prepping for through this conversation, again, just to say is our outpatient services hiring event. You can also expect to see other areas of Advent Health at this event, including laboratory, center care, hospice, home health, Advent Health Medical Group primary care plus, and well 65 plus. So there are a lot of other areas being represented at the hiring event that is taking place again on June 13th. So next week, 9 a.m. to 1 p.m. We'll share some more details throughout the conversation in regards to that, but I just wanted you to be aware that we do have other areas that will be present there. But again, today highlighting our 3 areas from our leaders that have taken time out of their day to join us. And we, of course, want to know, what are you all hiring for? Those are the exciting aspects of this conversation. So what positions will you be looking to hire for within your service line? And I will start with Jill.
Absolutely. So for this particular event, we're going to be focused primarily on our clinical positions. And so we're looking to hire a physical therapist, physical therapy assistants, occupational therapist, and speech language pathologist. And again, having the exposure into specializing into those ortho, neuro, peds, and different specialties that we talked about. And for PTOT speech is what we're looking for.
Thank you so much. And Andrea.
So specifically for this event, we have a few positions in multiple locations. It's the same positions, maybe different shifts. So mammography, MRI, CT, ultrasound, breast ultrasound, and then for regular general ultrasound, we ask for abdomen and OB registries. But we do, of course, help with those. And that would be full-time, part-time, and per diem roles for all of those as well.
Perfect. Thank you so much for clarifying that, as there are different shifts in these areas as well. And then Keisha, if you could cover for our specialty care.
Yes, so for the medical group, medical assistants, they do make up a majority of our clinical team members. So we're adding additional new providers. So we're looking for excited and passionate medical assistants. We will need some front office team members as well. Depending on the practices, there may be positions open for RNs and LPNs. And again, these are full-time positions that we're looking for.
Thank you so much, Keisha. I appreciate that. And moving on, can you tell me what a typical day looks like for clinicians in your offices? Keisha, I'm going to pass that back to you just to give us an overview on that realm.
Sure. So, for our clinical team members, they're expected to start the day by completing an assessment of the environment. Once we check the environment and verify that it's ready for patient care, we begin to see our first patients of the day. After our patients are warmly greeted and checked in by our front office team members, the medical assistant will complete intake. Intake includes like height, weight, vitals, medication history. We basically prepare the patient to see the provider. In addition, the medical assistant will prepare the room for a procedure and even assist the provider with the procedures. Now, our RNs and LPNs within our practices perform various clinical tasks according to their scope of practice. So they may perform like stress testing, accessing ports, providing patient education, and really a lot more. That's just really a small look into what the day looks like for our team members. But again, we value them and they do a lot within our practices.
Thank you, Keisha. And Jill, would you mind sharing an overview with us on this as well?
Absolutely. As Keisha mentioned earlier, the great thing about ambulatory a lot of times is the fact that there isn't a lot of the overnights and weekends. And so our clinics are generally open roughly about 7 a.m. to 7 p.m. because we want to make sure that we are available for our patients, right? So the workers before work, school, and things like that. So we offer flexibility with shifts in order to ensure we're providing access. Our clinicians in general, I mean, you're going to see probably about 2 to 3 evals a day, depending on the specialty. Again, that's going to vary. We do the shifts between 8 hours, 10 hours, depending on what works for you. We have patient tech support for you with the clinician, right? Which is super helpful to have those additional hands-on. So you kind of have a team that's kind of helping you get through the day and care for the patients. We also have front desk support to assist with scheduling, obviously customer service, as Keisha mentioned, and doing authorizations and reviewing insurances and things like that. So there's a lot of collaboration amongst the team, learning and growing always. We like to collect outcomes and then always finding time to have fun at work as well. So that's a big piece for us, our typical day.
Thank you so much. And Andrea?
Yeah, so in imaging, we have multiple modalities running a day. We could be open anywhere from 7 a.m. to 11 p.m., but of course, since we're outpatient, we don't run 24/7. We are closed holidays. Each location, we have a front desk team. Each location has a manager, and our radiologists, which are physicians, they do sit on site and they do roll up through Advent Health Medical Group. So if you're in procedures or diagnostic mammograms, you work very close with the radiologists, but they do sit here in each center. And I would say the environment is fast paced, but it's a workload that is manageable and it's consistent. And the front desk team is very helpful. They'll let you know when your patient is ready to be seen. Once the patient is checked in, insurance authorization is verified. So we have a very good working relationship with our clinical and our non-clinical team as well.
Thank you all so much. I think, again, for those of you that have joined us today, this is invaluable information. We're giving you an insight as to what it's like to be in these offices with our leaders that are with us today. And this is very rare that you get to hear these details, right, and get that picture painted for you. So I hope everyone that is listening is enjoying and getting a good idea of what they can expect when hopefully some of you join them in their areas. So again, we're looking at our overall needs, and there are lots of needs. I see there's questions being answered in the chat. So thank you, Kayla, for managing our chat today. Kayla Gentry is a part of our academic strategy team. So she will continue to monitor those questions and send some to me again at the end for Q&A. So if you do have questions that arise as we're talking today, we will discuss some at the end of the conversation. So please feel free to communicate with us there as well. So moving on, I want to know how you got into healthcare. So how did you choose your office or your specialty that you're in, and how did it end up being Advent Health? Keisha, would you mind touching on that for us?
Sure. So I can tell you, since I was a little girl, I just knew I wanted to be a teacher, right? I truly believed like I wanted to work with children and expand their horizons by exposing them to this new and exciting information, right? Until I worked with kids and I realized that it takes a special person to work with kids, and I just did not happen to be that person. So I thought about a field where I could still show compassion and minister to people in need. And that's when I realized my calling was to become a registered nurse. So as a nurse, you're really there with people during their most vulnerable times. You become like this patient advocate and educator. and you're thinking critically all at the same time. And really, I'm just so thankful that I've been able to merge my love for education and healthcare into my current role. And I just feel like it's truly fulfilling for me.
That is wonderful. Thank you. And that obviously shines in the way you interact with all of your team members. So I appreciate you, Keisha. And Andrea, would you like to touch on that as well?
Yes, thank you. So I grew up in Orlando, and before we went Advent Health, I saw how we were growing as Florida Hospital at the time, and with the name change and how big our hospitals are, we never lost sight of helping the community and, of course, our mission to extend the healing ministry of Christ. So I always knew I wanted to be part of something bigger, and I was lucky enough to get a role within the hospital, and I've loved it ever since. I haven't looked back, and I definitely want to keep working with Advent Health. It just feels great to feel a part of something whole for sure. And I would say imaging specifically, it's one of those service lines, and all of our service lines are so important. But to me, I get very attached because one scan can make a huge diagnosis for a patient. They go through all of these things from their PCPs to maybe the ER, maybe to their specialists, and when they get to radiology, it means everything. The time is everything. So for me, I'm very, very big on making sure our patients are seen quickly, efficiently, and quality, right? Because these scans can be a life-changing diagnosis for our patients. So it just feels good to know that you're helping make a difference and hopefully intervening early for these patients to be seen with the rest of our physicians.
Thank you so much for sharing that. I appreciate it. And moving on, what makes your service line an amazing place to work, Jill, and what keeps you here?
Yeah, so I grew up as an athlete, playing lots of different sports. So unfortunately, and fortunately, I guess I received a lot of physical therapy. So always was interested in the field. Thought myself that I would be a physical therapist, and I, like Keisha, learned quickly that no, that's not for me. So I decided to do the operations side, and so I started in this department, majored in sport management, and was like, okay, how do I get in here and kind of figure out how to use my skills to kind of still be around this setting? And so what's been beautiful is I started as a front desk registration representative, and my career has evolved in many different ways. And I think that's largely in part to our department as a whole, but also the team members just who are in there and the leaders that are there. There's so many opportunities to learn and grow, not only offered by Advent Health, but the specific departments, and everybody supporting you and wanting to see that growth and development. We have a huge passion for clinical excellence, and we are encouraged to be creative and innovative, and how to just continue. We have our own little internal kind of mission, if you will, to change the world, especially with our profession. And so we get to do that by extending the healing ministry of Christ and taking our clinical excellence to the next level. And so I love what we do as a product, if you will, and a service line, and being able to improve the quality of life for our patients and our families and caregivers, and as well as our entire team. So doing that for our team members as well. So that's kind of why I stay, because I just love this team. I love what we do, and I love the impact that we have on our community.
Absolutely. I've heard the word community shared between many of you, and it's truly community here at Advent Health. We are driven by our mission to extend the healing ministry of Christ, our service standards, everything that is talked about is lived out throughout our teams. And I really want to highlight Jill again, her story in regards to starting off at the front desk and getting into her position that she's in today. That type of growth path is possible at Advent Health, and I think that's just a beautiful thing to really highlight and keep in mind as I see some of you are putting questions in the chat and looking at non-clinical roles and knowing that you can still lead out teams and be a part of a clinical world, being in a non-clinical position yourself. That is, again, a big part of what is wonderful at Advent Health, that you have the chance to impact others and to carry out our mission, even if you don't have a clinical background. So thank you all for sharing your stories and how you got into healthcare and why you're staying here at Advent Health. I hope that inspires those that have been listening along with us today. So speaking of mission, Keisha, would you mind sharing how the mission of Advent Health has impacted your career personally?
I'd love to. So working at Advent Health has really helped me to incorporate our mission, again, of extending that healing ministry of Christ into my day-to-day. Really, it's not just a slogan that's written on paper. It's a living mission. It affects how I interact with my coworkers, other departments, and even my communication. I can tell you that during my my time with my previous organization, truly I dreaded going to work. I would drive into the parking garage and just sit there wishing I was off work already. But working for an organization where the mission is at the center of where decisions are made or processes are created, even how leaders interact with their team members, it totally changed my mindset professionally. Since working at Admin Health, I can say I have truly noticed an increased sense of professional fulfillment, and it helps me to love what I do even more.
And Keisha, I appreciate your transparency because it is tough to be in a position where you don't feel fulfilled. You're not driven to get up every day and go to work, right? Sometimes that's a very real reality for maybe some of our listeners today. And I'm hoping that for those of you that have joined, that maybe that is your reality, that you joined us today because you're considering joining our organization and finding that mission and purpose. So again, thank you for sharing that, Keisha. And for those that are in that position, what are some interview tips that you can share with attendees as they again prepare for our upcoming hiring event on June 13th?
So I can say that outside of professional appearance, which we know we need, my number one rule is to be prepared. So an interview, it gives us a glimpse of your knowledge, your experience, and your personality. If you're going into a clinical role, be prepared to answer knowledge-based questions. Do you know the angle of a subcutaneous injection? Or if you're performing an EKG, what landmarks are used for V4? These are things that you should be prepared to answer depending on the specialty that you're applying for. I know that interviews can be nerve-wracking, but let your interviewer see your personality. Many questions are behavior-based, so it's important to make sure that you will work well with the team to fulfill the mission, not just have a solid knowledge base. We want that too, but we need more than that when joining the mission. So before you go in for your interview, research the mission, the vision, values, service standards of the organization, because this will actually direct your answer for some of your questions. For example, one of our service standards is love me. So be prepared with an example of how you demonstrated this service standard, either in school or at your current job. Be prepared with examples of how you resolve conflicts because we know that they will arise. So again, be prepared with all of as much information as you can and as many examples as you can gather, because that will definitely help you. And lastly, Les Brown, he's a motivational speaker, and he said that your smile will give you a positive countenance that will make people feel comfortable around you. So my last little info here is do not forget to smile.
Beautifully said. Thank you, Keisha. That is, again, one of our service standards outside of Love Me is make it easy. And that is why we do these virtual panel discussions at its core, because we want to make it easy for you all who are interested in joining the organization to get some insight as to what it's like to be within our walls and to experience Advent Health and to hopefully get a position with us. So thank you for sharing that, Keisha. I hope that information was really taken in by our listeners because it's so valuable. And again, remembering to smile is so important and feeling comfortable with some of these leaders that you're looking at today. They may be the ones interviewing you. So being prepared for that and keeping those things top of mind. Now, obviously, we are looking forward to having a lot of you join us within the organization. But once you're here, I know a lot of you will continue to grow and want to grow. So Jill, if you could you talk about how you assist team members with growth within the walls of your own offices? So that way we know our listeners today know what to expect.
Absolutely. So we have a lot of different opportunities in regards to learning and growing. And so, especially in the clinical world, we actually have a schematic, if you will, that will actually share that you can grow. It depends on what you're passionate about, right? So you have the opportunity to shine in, you say you're focused solely on clinical skills, right? So you can dig into that and go onto a whole path that grows all the way throughout the system, in advancing into compliance, clinical, chart review, research. There's other opportunities in leadership if you decide to go that route. There's ways to do that. There's other pieces to be a part of in, like I said, the innovative piece of it, right? So we were recently launching Run PFX and Sports PFX and different things. We're doing multidisciplinary multidisciplinary clinics, and what are you passionate about? And so we meet with you regularly in order to have professional clinical development plans, understand what we can expose you to, what we can get you in front of, what are you interested in, what can you participate in. But then there's also a lot of things that Advent Health as the organization offers too, through the Learning Network, where there's web-based, virtual, in-person learning, things like that, that can help you pursue what it is that you're looking for. So I think that kind of ties it up in a nutshell, but there's a lot that we offer to support growth in that. We do rounding, consistent rounding with the teams. We participate in focus groups. We do a lot of journal clubs, article reviews. Hands-on breakouts are huge. We do care process models together where there's didactic learning, but then also the hands-on piece as well. And so just there's so many different avenues. And I would say that the great thing in this world is that we have technology. And although Advent Health is a very large system, it allows us to take a big company and make it small, because you have the access across a large system and a network, virtually, in person, what have you, email, Teams chats, different things, to get the support that you need to learn and grow and get mentorship. But mentorship is definitely another key piece.
Definitely. Thank you, Jill. And I did share that schematic for our listeners in the chat as well, so they can review that and just see the ample amount of opportunities that there are for growth within your area. And Andrea, would you mind speaking to this as well as in regards to growth within imaging?
Yeah, so we have quite a bit of growth in imaging. Of course, everything that Jill mentioned, our corporate and our education teams do a great job of that. Something that we do specifically in imaging is that we do have partnership with Advent Health University, but within our own site, we also offer cross training. So, for example, we take some of our employees after you've been here for 6 months, you want to grow into another modality. We recently just had an X-ray tech who did their hours. They learned with us MRI, and then they sat for the registry. We paid for the registry, and now they're an MRI tech. We've had people go from X-ray to mammography as well. So we have quite a bit of opportunities to, regular mammo techs who want to get into breast procedures as well. So it's really like what Jill said. I think growth is different to everyone. It depends on what you want to learn. You want to grow into different modalities. You want to be multiple modality. You want to grow into leadership. So really depending on what's tailored for you is what our managers will focus on for you.
Thank you. And that's such a key piece that you mentioned there, being able to have that open communication with your managers at Advent Health in regards to how you want to grow is really key. That is a huge, huge opportunity for you here to be able to know you have that opportunity to be able to speak up for what you want next for yourself, and that your manager will be there to support you. So thank you for sharing that. And Keisha, did you want to touch on growth within our specialty care as well?
Sure. So we have an MA sub-council that allows for MAs to, from each specialty, to represent their service line. Sub-council members will present the concerns of those within the service line, and then the MA sub-council works together to improve clinical practice. We've got a career ladder program for our medical assistants. The career ladder program, it serves as like a professional development tool to enhance our members' understanding of quality metrics. And we begin to introduce them to various leadership skills such as communication and how to handle difficult conversations. We have a fast track program where our non-clinical team members can attend the program and transition into becoming a medical assistant. So we have a lot of different avenues for them to grow. They can grow within their role, or they can even grow to the next level professionally.
Perfect. Thank you so much, Keisha, for covering that, and for all areas being clearly shown that there are different routes for growth and opportunities for you to learn and have a lifelong career truly within Advent Health. And I know this was mentioned in our intros as well. So continuing education is one of the wonderful benefits that we have at Advent Health. So whether that's a full education paid or certificates being covered. So I'd love to talk about what opportunities your team provides for continuing education. Jill, would you mind kicking us off on that?
Absolutely. For our clinicians specifically, we have access to continuing education dollars. That's definitely based on your status, so full-time or part-time. In addition to that, we offer paid continuing education days. So sometimes those courses are over the weekend and things like that. So we also allow you a couple days, depending again, based on status. We do offer 3 residencies, orthopedics, sports, and neuro residency. And with those, obviously there's application process for that, but you have the opportunity to decide if that's something you want to do. With our ortho residency in particular, we offer over 10 residency modules each year, and they are broken down by body part. And all of our clinicians and employees have access to these residency modules for free, and you obtain continuing ed dollars. So that's a big piece as well. We also support, we love to grow, and we love for those who really achieve their board certifications. So we support that too. And we have for like an orthopedic clinical specialist, for example, we actually have a study group that is actually running at 100% pass rate at this point. So we're continuing that journey, and our teams just have a lot of fun. And again, that's another way from an innovative piece where a team member just created that one day. And here's where it's evolved over time, and more people are taking advantage of it, which is great. So again, pursuing all those different opportunities, that's just a little bit from a continuing ed perspective that we offer, but we definitely support it for sure.
No, that's incredible. And again, just to highlight that a team member suggested a way to continue to learn and grow, and that was supported and elevated. And I think that just speaks volumes to, again, the care that our managers have to take care of our team members and to understand their needs and to tailor what we offer to be able to support them to get them to where they want to be one day. And Andrea, I know you mentioned that you yourself took advantage of continuing education. Would you mind speaking to that and what that experience was like for you?
Yeah, so I took advantage through Guild for my undergrad degree, and then I used it for my master's degree. And it was a great opportunity. Guild is amazing. Depending on the school that you choose, they even, most companies do tuition reimbursement. We now offer direct payment depending on the school that you choose. So it's a great opportunity. I always tell people, even if you want to start, you can't do full time, just start part time. They're paying up front, which is a huge benefit. Not having to take the money out yourself, wait until your semester's done. So it was honestly amazing, and I definitely don't regret it. So great opportunity to do that while you're working as well.
Thank you so much. And if you don't mind sharing, what did you study when you went back to school?
My MBA.
MBA. Wonderful.
At
Yeah.
UCI. Go Knights.
Yeah, I love it. I love it. It is, and that's a wonderful thing to highlight again, as I know, obviously, Andrea not operating in a clinical role as well. And again, we support growth on the clinical and non-clinical side of things. So I just want to make that clear to everyone that I know some of the roles that we're highlighting today might be clinical that we're looking to hire. But if you've joined today just wanting to learn more about Advent Health, there are lots of opportunities for growth and continuing education, even if you are not in a role again that is clinical. So thank you for sharing your story. I appreciate that. And if you could just speak to the programs that are built into your service lines that allow for heightened and learning and growth. So Keisha, can I pass that question to you?
Sure. So I know I've mentioned the sub-council and the career ladder program. Our fast track program, again, allows non-clinical team members to become clinical team members. But I'm really excited to announce that we've begun specialty specific training. We really want to empower our team members to be subject matter experts in their practices. So during this training, we reviewed disease processes, expected orders, medications. We perform skills checkoffs. This has been extremely successful in allowing team members to ask questions to gain clarity in a really a safe learning environment. So I'm really excited about that, in addition to what we have currently. And also we have a program that allows non-certified MAs to get study materials and support to become certified MAs.
And that brings up an important point that I want to highlight, Keisha, for our listeners. So you all do hire non-certified MAs, and then you assist them in that, just to clarify for our listeners.
So typically we try to keep the team member, we want our team members certified. Mm-hmm. If they happen, for instance, we've had someone that has come in as a secretary or a medical receptionist because they have worked as a non-certified MA in another state. Then when they come in, we can give them the materials for free for them to study, they can test, and then they can transition into a certified role. So typically we do hire certified medical assistants in lieu of non-certified, but there are certain circumstances where we will.
Yeah, no, that's great. That's wonderful to know there's opportunities to start. And if that's your ultimate goal, knowing that maybe the medical receptionist is where you begin, but knowing you'll have that continued support and education there for you is really important. Thank you for highlighting that. And then we mentioned this that, of course, in our roles, we want to have fun. We want to be able to enjoy time with each other. Work-life balance is so important, and just feeling fulfilled in your role overall. And one of those things that is needed is obviously just a high morale within your team to be able to enjoy each other and the facility that you're in. So, Jill, if you could just talk about some of the things within your clinics that are done to increase the morale of your team.
Absolutely. So we do weekly staff meetings. And so during those, it's important for us to stay connected, have open communication, right? And so they vary each week. And it could be that we're going to do a breakout, or we're going to do an in-service, we're going to do team building. We're going to go out and play a game. We're going to do something together. So doing team building and then celebrating our successes, or celebrating an accomplishment, or celebrating a new baby, or we just got married, or whatever it is. We like to do a lot of that. We love potlucks. And like our patients always like to bring us food and sweets and all the good stuff. So we like to do that together. We also do town halls for our department as well, program meetings that are focused on solely your program. So that could be the different ortho, neuro, different things like that, but also for non-clinical, we do that as well. We love to brainstorm. So the voice is important. Your voice is important. We want to have ideas. We want to hear your feedback, and we want to figure out ways to improve on how we're doing, improve the experience for our patients, and then get creative. But again, the dialogue is important. So having that trust building, that team building, open communication, and then having fun at work. But then a lot of our teams have fun with each other outside of work too, which is a beautiful thing.
Yeah, absolutely. Thank you for sharing that partnership and that camaraderie between teams and team members is so important. And obviously, all of you work with a variety of teams within your facilities, and knowing that that's happening in all of them is really important to understand and to be grateful for. So thank you for sharing that, Jill. And Advent Health, again, we spoke about how Advent Health is so ingrained in our communities that we're focused on giving back to the communities that we serve in. Again, we are a faith-based nonprofit healthcare organization. So our goal is to keep investing back in our communities, because we want where we are at and beyond that to be better than where we left it. So if you could, Jill, just talk about how we give back to the communities in which we serve right now.
There are so many different ways. I mean, within the organization itself, but our department specifically, we do a lot of things like adopt a family. We participate in a lot of walks. We like to do those with our patients and our families. Um, Two other key areas I would say that are unique to our department is we offer what we call our Neuro Night Out, is an example. And it's a night to celebrate with our patients and our families. And all of our teams, the providers, we all get together. We're all volunteering our time. We're getting donations for food, and we're literally catering to them. We're serving them meals. We're celebrating them and giving them an opportunity to share their talents. They'll do artwork. They'll do singing. I mean, it just brings you to tears. Tears. It's so moving. So we're having our 6th annual one this year, and actually having our first one out in East Florida Division as well. And another one we do is a sensitive Santa. It's an opportunity for our patients in our pediatrics department with your developmental delay, or just having all different diagnoses, where you just can't go to the mall to that Santa because it's super, super overstimulating. It's not an environment for them. And so we provide this for our patients to meet Santa, have that setting for those families to get those pictures, those moments. All of our team members are there. We're there to help them with that process as well, because we have relationships with the patients as well. And so we get to do that and have a lot of fun with them. And then we always are participating at our local races and bowl games and different things like that as well, and feeding the homeless, anything that we can figure out. But a lot of our team members will come with things that they're passionate about, and we just all jump in and want to participate.
Thank you so much for sharing that, Jill. And for our other two panelists, was there anything else that you would like to add that's specific to your practice or your area, to where you two work on either just team bonding or giving back to your communities? Okay. I will go ahead and jump into work-life balance. Of course, this is something that is key to being able to keep that morale high, right? So when we talk about work-life balance, Keisha, if you could just talk about what that's like, especially with our Advent Health Medical Group and our specialty care.
Yes, definitely. So I really feel like the foundation of maintaining a positive work-life balance is caring for the whole person. Whole person care, it applies to our team members just as much as it applies to our patients. So we offer mental health resources for our team members. We have created various health initiatives. And just like Jill said, we have plenty of volunteer opportunities to allow team members to give back. I participated in some where we do, hand out food or create meal kits or, gardening outside for the community, various things. I can attest it truly is rewarding, and it really is yet another avenue to extend that healing ministry of Christ. As far as work life, in addition to remote positions, which we do offer for some of our medical assistants, many of our practices, we mentioned it, but I'll mention it again. They're open 8-ish to 5-ish and close weekends and holidays. So really this allows for our team members to have set days and times that they work to arrange for child or elder care.
Beautiful. Thank you for sharing that. That just, again, speaks volumes to the culture that's been created here and focusing on that work-life balance because we care about those that we love most. And we actually have the opportunity to all wear heart badges. And those say, I care for you like. And then when you're a team member with us here at Advent Health, you get to fill in what that heart says, whether that is a spouse, a mother, a grandmother, a child. It's a really beautiful way that we get to represent who we're treating everyone that we interact with like. So if you could, Andrea, if you could just speak to who is on your heart badge and why.
Yes, thank you, Sky. So on my heart badge, since day one from orientation, I have my brother Carlos, and it's a great way for me to remember to treat every patient like I want my brother treated. My family didn't grow up with healthcare. They were business owners and struggling to make ends meet, so we never had the opportunity to even have insurance. My brother has narcolepsy and cataplexy, so it was something seeing my parents go through that as self-pay. I think that always made me very, very just attached to those patients who have to go through that, right? We are a nonprofit, so we offer a lot of opportunities for our patients to have financial assistance and to help them with their bills. We definitely help our patients navigate that. So for me, it's just a reminder of all the visits my brother has gone through. I always want patients to be treated just like I would want him to be treated.
That is beautiful. Thank you so much for sharing that. And again, just highlighting our care for taking care of those that may be going through similar situations of not having insurance or not being able to make ends meet and just extending that love that Christ would. So thank you, Andrea, for sharing that. That's so important. And again, it's a beautiful opportunity that you will have when you join our organization to highlight that. And it's a great way to be able to connect with other team members. It's so important to build community within each other. And it's always so nice when you get an opportunity to speak to who is on your heart badge and why. So it's not just something we highlight here. It's something that's built into just daily conversation and especially when you join the team. So thank you for that. And again, this organization is growing. Our hope is to double in size by 2030. We want to be a household name by 2030. If you're in Florida, we already are, but we are certainly growing and expanding throughout the country. Again, as I said, over 50 hospitals in 9 states. So really exciting to see the growth that has happened for Advent Health as a whole. But I would love to highlight the growth that is happening in each of your divisions over the next year or so. So I want to start with Jill. Would you mind speaking to the growth or anything that you can share for future team members to look forward to within your area?
Absolutely. So we continue to have exponential growth over the years. I can tell you when I started 15 years ago, I believe we had 10 clinics at the time. And the fact that we're at 42 and hoping to add another 3 by the end of this year and plans to continue that growth year over year is important. So that is something that we're constantly on top of. Our goal is to be in the community and make sure that we are expanding our footprint and making it easy and for patients to come to us, right? So for outpatient rehab, you have to live within 15 minutes, 15 miles in order to come there. So sometimes there's a lot of different gaps. And so we have the opportunity to continue to expand that footprint and open more in the community so that we have more options for our patients. So we're always growing. So Sports Medicine Rehab is always here. And then we're growing in our clinics and our current clinics where we're adding clinicians to support the growth of all of our programs. So it's a continuous thing for Sports Medicine Rehab. I can tell you it's a lot of fun and it happens fast.
Well said. And that is true for the organization as a whole. We are just a continuously growing, improving how we treat our patients and how we take care of our communities. That is just built into the mindset that we have. So thank you for sharing that, Jill. And Keisha, what can you share in regards to growth for our medical group specialty care practices?
So I feel like Jill, we are really expanding throughout Central Florida. So we are opening more and more practices throughout Central Florida between Lake, Polk, Seminole, Orange. Take your pick. We are opening practices there. And that will require additional support. We are looking to hire quite a bit of providers this year and the next couple of years. And if we hire providers, you know what that means. We need clinical support from our medical assistants, RNs, and LPNs. So as more providers join the medical group, there'll be an increased need for clinical team members. More internally, we are improving our professional development opportunities. We're revamping some of our professional development programs. And I'm just really excited about what this year will bring.
Thank you, Keisha. Again, wonderful to hear of lots of growth happening for you. And Andrea, anything to share for imaging in regards to growth?
Yeah, so for imaging, we recently, our newest location, our 13th location, a Celebration Point a few months ago. Like Jill, imaging had 4 locations at one point, and now we're 13. So at one point, we were opening up 2 to 3 locations a year. We also have health parks, which is a newer thing for Advent Health in general, multiple services in one location, offices as well, rehab, lab, imaging in those. So it's kind of a one-stop shop. So I think that's the new ones we are focusing on. As of right now, the only one coming up probably in the next year or 2 is going to be somewhere in the Winter Park location. But in our current locations where we might not have land or somewhere else to build, for example, Altamont, Orlando, we're just expanding our hours. So we're offering now weekends, or we're offering looking for weekend and nighttime team members, adding new machines. So Oviedo is a great example. 2 weeks ago, we just added a whole new center. We leased out the suite next door and added more MRI, mammo. So now we have 2 MRI units in Oviedo. So we added whole new staff there. And that's really what we're focusing on, is trying to expand our current locations as well.
Thank you so much. Lots of exciting growth and opportunity. For those of you that are on the job hunt right now and really looking to secure a position within an organization that is secure and growing, that is Advent Health. So thank you all for sharing the opportunities of growth in the future, especially for those of you that may be moving here. Maybe you're not currently watching from the Florida area, but you are moving to Florida. There are lots of opportunities to come for you in all 3 of these service lines mentioned today. One thing, again, that I do want to clarify for those of you that are on our virtual panel discussion today is that this hiring event is, again, a clinical hiring event. I know the leaders today have mentioned some positions within their offices that are non-clinical. Again, I will run through the positions that we have. I will drop those in the chat just so everyone can kind of see. It is on the job posting, again, that has been shared. But we have lots of participating locations and roles that we are hoping to hire for. But again, I will drop in the chat in regards to the type of roles because they are clinical. So if you're looking at non-clinical roles, again, this hiring event will not be for you, but we do have non-clinical roles posted on our jobs page that we're looking for. So please make sure you're staying up to date on those. But again, just want to share some highlights in regards to our conversation today. We are hiring in all 3 of the service lines represented. Again, we will also have lab, center care, hospice, home health, our Advent Health Medical Group primary care, as well as primary care plus and well 65 plus, all clinical roles. Kayla shared in the chat in regards to the link to register for the hiring event. You can register for that today. So in that link, you will see all of the service lines that will be present, as well as the positions that are available for hire. I do want to mention, again, this was brought to my attention from the chat as well, not hearing back from a recruiter. That is something that may occur, again, just because we have over 1 million applications come in each year, and that is not an exaggeration. Again, I understand it can be difficult to maybe not hear back right away, but certainly suggest if you fall within one of these roles in the clinical positions that have been mentioned or shared in the chat, to show up at a hiring event, making sure that you make your presence known, you're sharing that personality, all those tips that Keisha highlighted earlier, making that in-person impression sometimes can really make a difference if the resume maybe isn't formatted correctly or isn't really speaking to what you do. And maybe that difference can be made in a face-to-face conversation with one of our hiring leaders. So please keep that in mind, and keep applying, keep your job alerts set up. So we have an opportunity for you to highlight the jobs that you're interested in and receive emails as soon as positions open, so you can stay up to date on all positions that are available within your service line of interest. I know we have about 10 minutes left. Kayla has been doing a wonderful job answering all of the questions in the chat. She did just share some resume tips. So if you are looking to have some help with your resume, she shared some great tips there of everything that we as Advent Health are looking to see clearly highlighted on your resume. And again, I did share all of the locations and positions that we're looking for at our hiring event. And just to cover those details with you, we have our outpatient services hiring event taking place June 13th. And again, that is 9 a.m. to 1 p.m. Eastern Standard Time. It's taking place at Advent Health Orlando, which is our flagship campus in downtown Orlando. It is in the Creation Conference Rooms. We will have signage, balloons to make sure you know where you're going. But again, that is on 601 East Rollins Street in Orlando. All that information has been shared in the chat, but a wonderful opportunity for you to connect with the leaders that have been in our conversation today and leaders within other areas of outpatient services. I'm just going to check our chat to see if there are any other questions that we can address for our attendees. For any of our panelists, if you have anything else that you would like to share before we wrap up, please feel free to unmute and share that with our listeners today.
Hi, Sky. I actually just wanted to mention, because I didn't mention this earlier, I was hired from a hiring event. So yes, leaders are there, recruiters are there. It definitely works. So
that is great. Thank you for sharing that. Yeah, that is so exciting. That is wonderful and so encouraging for our listeners and maybe future viewers to see as well. Thanks for sharing that. Yeah, Jill, go ahead.
Absolutely. I just wanted to highlight, I mean, there's so many people graduating, and so we do take new grads. We offer a great support system from a clinical mentorship right from the very beginning, in addition to hiring on a temp license if that's something you're interested in. So I definitely want to highlight that because we understand what it takes, but also wanted to add on to what Keisha was sharing about life-work balance. It's such a big topic these days, and I think it's super important to understand that throughout your career, you're going to have life changes and life challenges that aren't necessarily related to work, right? And so it's important to understand what those are, have the communication with your leaders, with your team, and really leverage and be aware of all the resources that we have that Keisha mentioned. It's such a big deal, and I think that finding other ways to fill your cup, as she mentioned with volunteering, but in our world, a lot of that filling the cup is actually doing mentorship, taking students and things like that. And so it's something I would definitely encourage to know that there's going to be a lot of things that happen in our life. And it's important to know that we've got a village around us, and we have an organization that provides a lot of resources and classes and support groups and different things like that. So just appreciate the time to be here with you all.
And I just wanted to add on to that. I think village is the best way to describe it, because that truly is what you'll get once you join Advent Health. No matter what department, you will get that village, you will get that support. So you won't be alone. We are there to help you grow. And that's the one thing that I am so thankful for with Advent, is that they want us, our leaders want us to grow. They want us to do more, want us to do better, because ultimately that's going to help the patient. So I really hope that you have taken this information, and I really hope I see some names in orientation from this event.
Wonderful. Thank you all so much again for joining. I do want to mention, just because this was highlighted within our work-life balance, but it's something I do really want to hit home in regards to our benefits, the mental and emotional health resources that we do have. So at Advent Health, we do focus on body, mind, and spirit. So we have a team member well-being program that encourages you to take care of yourself, and you earn money by doing so. We have our EA program. We also have access to Headspace and Talkspace, and then enrich financial wellness. So we are covering all aspects of your wellness to ensure that you're taking care of body, mind, and spirit, so that way you can take care of your patients and your family and everyone else that you interact with in life. So it is a wonderful thing that we offer, and I appreciate you all. Again, Andrea, Keisha, Jill, thank you for spending time with us today. Thank you for highlighting your service lines. I'm so grateful that we were able to highlight all of the wonderful work that you personally are doing, your teams are doing, as well as the growth that's to come. And it all comes from leaders such as yourselves who dedicate time to investing in team members and showcasing the work that they've done to better your teams and your facilities so they can continue to grow and highlight Advent Health as a whole. So again, thank you all so much for joining us on our outpatient services virtual panel discussion today. If you are in the area and you plan on being here next week, we highly encourage you to start registering again today for the outpatient services hiring event, which is again taking place on June 13th, 9 a.m. to 1 p.m. But again, thank you for being here. We hope you found this information helpful, and we look forward to seeing you next week. Have a great rest of your day. Take care. Bye.
Bye.
You. Bye, guys.